I'm Elizabeth Albright. I am a GP at the Wolverhampton Road Surgery in Stafford, where I've been in practice since 1980 when I joined as a partner. We're a multidisciplinary practice. We have about 10,500 patients on our list, and we also provide an ENT triage service. About 3 years ago, we had an employed doctor working with us who decided to move on, and we wanted to review the way we structured our practice team. Instead of taking on another doctor, we took on an advanced nurse practitioner and a clinical pharmacist. The idea of the clinical pharmacist being that she would be available to do routine medication reviews, which were taking up a disproportionate amount of our time, leaving us free to see the patients who needed doctors.
My name is Dr. Banir Hussain, and I'm a clinical pharmacist. I run clinics around hypertension, and I particularly specialise in managing those patients who have high complex blood pressure. Some of the benefits that patients may get from seeing a clinical pharmacist is they may feel more comfortable speaking to a clinical pharmacist. We often take a holistic approach when looking at their medicines, not just the medicines which we are treating, but all the medicines that they're on. One of the key benefits for a GP practice is by having a clinical pharmacist, you build up a multidisciplinary team, which is great for the patient.
I'm Shalini Agarwal. I'm the practice pharmacist and lead in mental health. In my 15-minute appointments, I feel that I have more time to talk to the patient on various issues. For example, side effects, we can talk about risk and benefits, adverse effects, any interactions they're having, or any other medication they're having that is not listed on their prescriptions.
We are highly qualified, we have a good understanding of medicines, and as clinical pharmacists we are used to seeing patients and treating long-term conditions.
With the pharmacist, I felt like I had more time, which I found is better because you don't feel rushed. You feel like you've got more time to ask about medications and is this right for me, is that right for me? I'd recommend it, and I say to me it's just the same. The knowledge is just as good. They know about the medications. Sometimes you might find them know more about medications being a pharmacist.
I think the NHS England pilot is a really good idea. People often don't think of including clinical pharmacists on practice teams. It's quite a new idea. And they don't realise the enormous benefits that they can derive from working with a clinical pharmacist. Given the opportunity to try this out, I think they will realise that a clinical pharmacist is a really valuable member of the team, will be delighted with working with them and will want to continue it.